You want to make sure, especially early on in the process, that you have proper patient expectation management. And part of that is patient communication and communicating with a patient while they're inside the chamber. We created a patient education graphic that basically shows the majority of the hand signals that we use in our clinic. Dr. Jason Saunders here. Today I want to talk about patient communication inside the chamber. And so depending on the equipment that you're running, certain chambers are equipped with communication devices like an intercom system so that, the technicians and or the medical staff on the outside of the chamber can easily communicate with the patient inside. Some are not equipped with that. With soft chambers, perhaps it's easy enough that you could just speak loudly and communicate through the chamber walls themselves. But either way, whether you have that communication system or not, or you're using a soft chamber and you could easily communicate through the chamber walls or not, or there could always be a failure of those pieces of equipment, or there could be extra noise. Therefore, it's more difficult to hear one another. We always want to have a backup system. And in fact, in our office, it's not even a backup system. It's actually the primary system of communication. This is important for a few reasons. Number one, patients are often nervous when getting into a chamber. The list of concerns is often pretty high. What to expect? What is it going to feel like? Am I going to be comfortable? Is it hot? Is it cold? What's that feeling in my ears? Do I have to equalize that? I believe that setting proper patient expectations is critical for a good patient experience. That makes sense. I also really believe that patients coming to a clinic for hyperbaric, they're probably not doing one session or two sessions. Depending on what they're coming in for, this could be a 10-hour, 20-hour, 40-hour, 60-hour, 80-hour experience over some period of time to really make sure that the patients are getting the amount and the frequency of hyperbaric experiences or exposures that they need in order to get to whatever health goal or health challenge that they're trying to meet. This is a long-term relationship. And if you're going to have a long-term relationship with your patients, you want to make sure, especially early on in the process, that you have proper patient expectation management. And part of that is patient communication and communicating with a patient while they're inside the chamber. In order to do that, we basically use hand signals, and we use hand signals that are virtually the same as the hand signals for scuba diving. You could set up any signals that you would want, let's say in your clinic, but I also believe that we're at a turning point in hyperbarics where patients are going to be looking more and more for this type of therapy. And I believe that it's very important that within the sphere of practitioners of hyperbaric, that we all use similar language. We use similar equipment. We use similar protocols. We use similar patient education modalities in order for this industry to grow and thrive, but also for the industry to remain healthy. And for patients to have great experiences, we need consistency amongst all of us, regardless of how much we either work together or not, that there's some level of consistency between different clinics. And I think this communication part could be critical for that overall patient experience. And so rather than reinventing the wheel, underwater communication has existed for many years. Unlike in a chamber scenario, underwater, that communication is absolutely critical. In other words, a miscommunication underwater could literally be life or death. A miscommunication inside the chamber is much more unlikely to be a life or death scenario. But again, it's still about keeping that patient safe and aware of what's going on either outside that chamber or what they need to do inside that chamber within certain circumstances. And so I believe that using those very similar, if not the same hand signals is helpful in that process. We created a patient education graphic that basically shows the majority of the hand signals that we use in our clinic, and we show them to patients and we give them to patients so that they have an index. They don't need to memorize it right away, but they have like an index of like, oh, okay, I need to communicate with the technician. How do I say this part? How do I do that? Or they're communicating with me. What is it that they're trying to say? And after a few sessions, pretty much everybody gets it. They're quite simple that way. I'll use one example that's pretty easy. A lot of people, when they're checking on a patient, they might knock on the chamber, like knock, knock. Hey, is everything okay? And in fact, this means we're going back up, which would mean that the session is over and we're going to come back to the surface. So if they're in my clinic and I'm saying, hey, are you okay? We're coming back up. And then they go to your clinic and you're like, hey, is everything okay? They're like, wait, why Why is the session over? Why are we going up? So whether you're a chiropractor or a naturopath or an acupuncturist or a DO or even an MD, but you're looking at hyperbarics through this lens, the lens that I'm describing, which is applying hyperbarics for all these off-label conditions, this is the class that teaches that. And right now it's the only class that teaches this type of hyperbarics in this way, and that's an actual certification course. Check out hbotusa.com, and right across the top you'll see upcoming events. You can click on that and it'll show you when our next courses are going to be. Basically, this is the conversation that we have with the patient before their first session, and often before a few sessions. If I say, knock, knock, is everything okay? If everything's okay, I'd like you to look at me and just give that back. Everything is okay. And then we might say, knock, knock, your session is over. We're going to come back up to the surface, okay? And if they understand that, they can say, okay. I might say to them, listen, as the pressure's building, I need you to equalize your ears. If you see me doing this, that's telling you, I want you to equalize your ears. If you're having a problem equalizing your ears, you might say, something's wrong. Something's wrong with my ear. So we tell patients, listen, as the pressure's building, we want you to equalize early and often. The sooner you get to equalizing, the less pressure there is, the easier it is to equalize that pressure. The more you let it build, the larger the pressure against your eardrum, the harder, the more difficult, and even the more uncomfortable it could be to equalize. So I want you to clear early and often. But if you're having trouble equalizing, you're going to say to me, something's wrong with my ear, and we're going to know exactly what that means. And since we're able to control the speed of your dive and the depth of your dive on the outside of the chamber, we can help make you more comfortable. But we need you to tell us that in order for us to understand. Also realize that there's about a 20 to 30 second delay from the time you tell us something's wrong till that you feel the effect of what we're changing on the equipment. So we don't want to wait until you're in pain before you actually let us know that something is wrong with your ear. The sooner you tell us, the sooner we'll be able to help you. We also make sure that patients know you should never have pain inside the chamber. Never. If you're having discomfort, we need to know that, because we will make adjustments on the outside to help you be more comfortable before you actually reach a point of pain. If you're having pain, we need to take faster steps, larger steps to minimize that. But ultimately, you should never have pain in the chamber. So if you are, that's a communication error that we need to help each other with, so that we can help keep you more comfortable inside that chamber. Again, this is coming back up. So this would be the session. Let's say the session is over, we're coming back up. This would be, we're going down. So that's, we're going deeper. So the pressure is going to be building more. So in our office, we stage people through ranges of pressure. Let's say we want to get to 1.75. We might get them to 1.3 first, make sure that they're stable and comfortable. And then so we'll say, knock, knock. We're going to go down a little bit more, okay? And then they'll say, okay. And then I'll say, remember to equalize when the pressure is building. Again, these are very simple concepts, but they're important because we want to make sure that we have an open line of communication and that we're understanding one another, even when things might be more difficult to understand. And so all of these are just the little ways that we're able to communicate, right? So is everything okay? We're coming back up. We're going down a little bit. Something's wrong. We're going to hold you here for a little while. We're going to hold you, and now we're going to go back down. I don't want to make this more complicated than it needs to be, but I really want to make it clear that you really need to have some type of communication system in your office and a way of teaching your technicians or if you are the technician, your doctors, what hand signals you're using. Make sure that you're teaching the patients what they all mean, and that you can maintain a conversation from inside to outside the chamber and vice versa, and keep everybody on the same page. Again, this is just critical from a patient expectation management process that you should have built into your office policies and procedures to make sure that the experience goes great for them. All right. I hope that's helpful, and we'll catch you next time, next video.